I'm Tamara Gusa and I'm head of Data Insights and the Analytics. MEG was brought into Calvary following a big aged care acquisition. We kicked off with implementation across our hospitals, which is 13 hospitals in 2022, and then we followed with the 62 aged care homes, and then completed it with the home care services, and across Calvary we have 17 home care services. So the whole implementation took about 18 months across Calvary.
I'm Kris Salisbury. I'm the National Director of Clinical Governance at Calvary. So auditing is a really important fundamental part of healthcare. It's a way that we can actually check that our systems and processes are working well across our services, and gathering the data can actually be quite a burdensome job, and so what we wanted to do was be able to automate that so we could collect the data in an easy way, we could display that data for staff who need to be able to see it, and then we could spend the majority of the time, which is the most important part, of actually looking at where the deficits are and correcting those deficits. So by automating the auditing process and actually digitising it, we're actually spending the time on the areas we really need to, which is the fixing the problems that we find. So when we started to look at what we wanted for an auditing system, we looked at a number of vendors, and MEG came up as suiting most of our needs. So what we wanted was something that's not necessarily absolutely out of the box, that we couldn't customise, nor did we actually want something that we'd had to develop completely on our own. And so MEG offers the perfect solution between the two. So it's a system where they support us to actually build the audits in the way that we want. We can actually change them when we need to, when our organisation changes, when our needs change, and they support us to do that. But we don't have the strict structure of actually having something that we don't have the ability to modify. So MEG has actually been a really good partner in doing that work.
The biggest challenge was the size of the project and the size of the organisation that we were dealing with. The Calvary have the 3 divisions of aged care, hospitals and community care, and each of them had different requirements. We had to run the project around that. So the main challenge was really around the project rather than the software.
The main benefits we realised was the real-time dashboarding. So the ability for users to see their own data and see the ability, what they can do with that data, and the opportunities for change and for improvements.
Working with MEG has been really excellent. We are a complex organisation, having different needs across hospitals, aged care and home care, and MEG have been really good in listening to all of those different needs and actually adapting both the product and the way that they've worked with us to ensure that they've met all of our needs. So they've been really excellent to work with.
The most important factor in this project for its success is around the usability of the software. We're getting people to do things that are taking them out of their day-to-day clinical environment. So you have to make that experience friendly and nice and efficient, and with the MEG application being on handheld devices, then they found that experience really, really good and would use the software more and more.
I would absolutely recommend MEG to other healthcare providers. They do provide the level of support that you need to actually implement this type of program across the board. They're flexible and agile in the way that they respond to needs, and have been very responsive in everything that we ask.
The key to these successful partnerships is understanding what each party wants out of it and why we're there and what the ultimate goals were. I think we had that defined quite quickly. The project had been ongoing for a number of years, and each party knew what they wanted to get out of it.
Future of data is a key for Calvary. Big thing for me in this space now is automation. So how do we get our systems to talk? So we give more time to the people on the ground, which gives them an opportunity to analyse and look at the data and create their own opportunities in improving quality of care.